Anna. I am from Mexico. I am 53 years old, and my first language is Spanish.
Have you ever experienced a situation in which you didn't understand certain medical treatments due to language barriers?
Sometimes, when I come into here the first time, yes, was difficult, but now I feel much better. I understand the doctor tell me, or I say to the doctor what happened with me or with my kids. I'm fine.
Have you ever had a personal experience where this has happened?
But for example, sometimes it's difficult to say what is my problem. Sometimes in Spanish, I say that my problem in Spanish. For example, I say I have anemia, and the doctor say anemia. What is this? I say I don't know what is the name in English, but sometimes she say, oh, okay. She give me the translator. The doctor say the name in English and say yes, this is the name in English. And the people tell me this.
The health communication issue that we have chosen to tackle is miscommunication in healthcare due to language barriers. The main effects of miscommunication in healthcare are a reduction in the quality of care, poor patient outcomes, wastage of resources, and of course, high healthcare costs. Communication failures often have a negative impact on patient and staff satisfaction. Language barriers are a key cause of miscommunication between medical providers and patients. Language barriers often cause errors in care and medication prescriptions to occur. Often due to geographic distance, extreme weather conditions, environmental and climatic barriers, lack of public transportation, and challenging roads, rural residents may be limited/prohibited from accessing healthcare services. The combination of geographical challenges and language barriers can influence those who experience this to lean further away from relying on healthcare. Language barriers can have an effect on past medical history of the patient and can lead to misdiagnosis.
Hi, I will be discussing why miscommunication due to a language barrier is a public health issue. This is a public health issue because it can be present between the healthcare provider and the patient. This can result in negatively impacting the patient's overall care and the satisfaction of the services. As I did a little bit more digging on this topic, I found out that over 60 million people that live within the United States speak another language other than English. Overall, in result, this has led to most of our clinical facilities not having proper translators to make sure that the patient's needs are truly taken care of.
Implications of language barriers for health professionals include the effect of the patient-doctor relationship. When the patient is unable to be understood by his or her doctor, it devalues the information being told and makes it less personal. In result, the patient feels stressed and less confident. Likewise, for health communicators, their role is to ensure people who are affected by language barriers are still confident to go to their doctor's visits. It is also their job to provide tools to overcome language barriers, such as translators or bilingual doctors. From our course book, one of the topics focuses on fixing the problem instead of avoiding it, as well as the benefits of getting more information than needed. This directly relates to language barrier issues because many patients avoid fixing the problem because they are worried they will not be understood by the doctor. On the other hand, patients are less likely to ask questions because it's difficult for them to communicate, so instead they are left with a lack of information.
Our call to action brings awareness to the cultural barriers that are present in our healthcare system. Since the beginning of time, America has been known as the country that is a melting pot of culture. As a country that claims to pride itself on diversity, it is imperative, it is our duty to improve our health communication as a whole. This issue is a holistic issue that can create a danger. Language barriers pose challenges in terms of achieving high levels of satisfaction among medical professionals and patients, providing high-quality health care, and maintaining patient safety. So we created a few steps that can aid in the betterment of this. Number 1, a good interpretation service is increasingly important. While doctors may have tools such as Google Translate and other means, there are easily ways that there can be misinterpretation of feelings, of emotions, and of words that can be misconstrued. So we have to have a good interpretation system if we're going to use that means. Second, sometimes patients may come with family members who can translate for them, and while this seems convenient on the surface, doctors really need to avoid these situations if they can. For one, that aids with patient confidentiality, and two, that can help the doctor-patient relationship so that they can have a better communication. Three, don't just be bilingual, be bicultural. It is not just about being bilingual and translating medical terms. Doctors' offices should seek to truly understand the different cultures too. We would like to see holistically more doctors from other cultures entering the American medical field. Overcoming language barriers in health is what is vital for this medical practice. And getting good interpreters is as easy as picking up a tablet or phone. Having good interpretation services readily available is not a luxury, but a necessity.